if food can be connected with anything, like what's food's connection to like gender or race or something like that?
Gender or race? Well, like for race, there's a lot of food culture. There's a lot of traditional diets from different cultures, and so like with different races and minorities, you might have different traditional diets.
Right.
Like a certain, like I don't want to stereotype though, but like there are different cultural diets sometimes, and some are healthier than others, and also like, and that's another thing though. With there's also food access because in food deserts, usually it's in America at least, it's people that are black or Latino, or people that live in the poorest areas that usually live closer to fast food places in proximity. They're closer to fast food than fresh produce.
Food desert?
Food desert is like any area where there's not much access to supermarkets or grocery stores, usually more access to fast food or convenience stores that usually sell like really expensive, like either really expensive produce, like not the cheaper produce. Like ironically, in richer areas, like areas where people are richer, they have more access to cheaper produce. I'm not sure why. But so usually they have very little access to affordable, healthy food and more access to a lot of junk food. Right. So that plays an issue of race because people that are like in America, like say if they're black, they're more likely to be obese and have heart problems because of their diet. But it's also diet's not all about personal choice. It's all about access and environment too. Like if you're only surrounded by fried chicken and Pop-Tarts and stuff like that, that's gonna be the easiest to get.
Right.
And also it's income. If it's harder to afford the fresh produce, then it's harder to be healthier.
So these areas that are food deserts, is there a correlation between the income level of the housing? Like, is it cheap housing that is located in these areas?
I think, I'm trying to remember. Yeah, I think I read something like that. I don't remember how exactly they figured it out.
Right.
But they said low income area, so I'm assuming that means low income housing or.
Right.
Yeah.
Definitely.
And they measured it by miles, and I think there was one study in Chicago they did where they compared miles to the nearest fast food place compared to the nearest grocery store area. And like areas where there was mostly more white people, they were pretty close to grocery stores, but area where there was mostly black people, they were a lot closer to the fast food place.
Right.
So.
One last thing I wanted to ask about was healthcare in the United States. First, have you been able to afford medical care?
Well, I think I'm still on my mom's health care plan until I turn 26. I'm not sure if that's changed since the Obama health care plan thing. Because I'm 25 right now, and I think I just got her dental insurance. But I think I'm still on her health care for like one more, or until I finish grad school, I think. So I'm kind of worried about that because whenever I get finish grad school and try if I can get a job, I need to find a way to afford health care, which
right.
is I'm pretty healthy, but I don't know what's going to happen down the road. So
right.
I am kind of worried about that because it's like crazy expensive. I almost think it'd be cheaper to not get health care and just pay out of pocket, because even if you do have health care, like my mom has a pretty good health care plan, but you still have to pay a lot of money out of pocket when you have any kind of checkup or anything like that. So
right.
I don't know. I'm more about preventative care and like trying to eat as healthy as I can, because like that's like the only thing I can really do if I don't have health care. So
right. And how would you feel about a universal healthcare system in the United States?
Like from what I've read about universal health care in other countries, it doesn't seem like a bad idea to me. It probably depends on how it's implemented, and I think like in a country like America, people are going to freak out about that because they're like, oh, communism or whatever. So it might be good to like have some kind of choice. Like you can either opt into this free or subsidized healthcare system, or you can pay more and have some kind of different healthcare system. Something like that might work.
Right.
But I would really much prefer healthcare not being controlled by businesses. That's how I feel about it. So.
Right.
Because I don't think public health should be in the hands of pharmaceutical companies and insurance companies.
Whose hands should they be in?
The medical I won't say medical professionals, because there are some people that more traditional people that have their own way of doing things, but just people who generally want to treat people's health and see that people are healthy, not just insurance companies. I don't know how to word that, so. But yeah, the people's hands, like people shouldn't worry about having to get health care if like they're already, like if they already have some kind of condition and they can't afford to get some kind of treatment, so.
Right.